In 2019, the Royal College of Nursing Public Health Lead proposed the creation of nursing student placements within the Barnet Public Health team. A collaboration between Barnet Council and Middlesex University was undertaken to realise this goal, and a novel, local authority-based student nurse placement was developed. The first to undertake the placement were Zoe and Janae, two child health student nurses. The public health team welcomed the students and tailored the learning experience to meet their specific needs. During the placement, the two students visited many of the public health interprofessional teams. They visited schools, community centres and allotments. They learned about promoting public health in the community and were involved with teaching the benefits of healthy eating, vaccination programs and smoking cessation. The following videos share some of Zoe and Janae's thoughts from their initial placements.
We went to public health as part of our placement, third year placement for nursing students, and we were the first ones from Middlesex University to go. It was a great opportunity. We had the opportunity to sit in different meetings and conferences about what public health do for our immediate community and also nationally.
So I was able to meet new people. So we was able to go to a social prescribing course, which allowed us to see what the public health team do outside of the hospital.
There's continuous new data that comes through. We sat in on a vaccinations meeting, for example, about all the different schools that have had the uptake of vaccines and which schools haven't and reasons why people haven't, which would give us then more understanding that when we go out onto the wards or into community, wherever we decide to go eventually, we've got more of an understanding of why some parents don't vaccinate their children and how we can help to encourage immunisations.
So we went on a mental health first aid training course, which allowed us to have an outlook of how we can support those with mental health and how to acknowledge those that are suffering and just how to speak to them as well. And I think having an awareness of mental health is so important, especially being in a hospital and working with children. I think the mental health training just allowed you to see things from a different perspective and just see what can I do to help and what can I say to help and what if I say. It just makes you aware of what things you can and then what things you can't say as well. So I just think it's just good I think everyone should go on that training just to have the awareness as well.
Another benefit of public health was networking. So there was a few conferences and meetings that we went to that although we might not have the benefit of utilising these people that we met now, eventually when we go out into work, or even now looking at work that we're doing for our assessments and assignments, knowing who to speak to about the different things that we need, and knowing who to approach, and it's not always about work. There's also that social side of it, meeting new people, making new friends. There's certain people that we bonded with really, really well and felt a connection with, like you do with any place. And I think that really helped build our confidence and us grow as a person, that we were part of a team. Even though we were very much independent learners in many ways, we were part of a greater team and working together for the benefit of our community. Going into a placement in public health, you do have to have that ability to work individually or have it as something that you want to grow as a person, to be able to build upon, because it's a great opportunity to find your way and find your voice, be able to speak out in a safe place, practice your research skills, because you do a lot of that. You pick a project, you find out what you want to work on, and you go with it, and you speak to different people that that will interest you and that influence your project. And this is something that you can grow as yourself. And there's loads and loads of benefits to this working, which we'll eventually be able to bring back into practice, working independently but as part of a team.